Hello, this is Cindy Rubin. I am the owner and founder of In Touch Pediatrics and Lactation, a home visit general pediatrics and breastfeeding medicine practice outside of Chicago. And this is Keeping in Touch. We are going to talk today about PTSD and breastfeeding. PTSD stands for post-traumatic stress disorder. And I've been thinking about this a lot because I've had a few patients recently who brought this up actually as we were talking about their situations. And it really is not uncommon for women who have had a difficult experience breastfeeding with one baby to have a version of PTSD when they are expecting to or hoping to breastfeed their subsequent baby. And this can happen, I think, similarly with birth trauma, with just birth experiences that did not go the way one expected to and came out feeling like there was some either physical or emotional trauma during a birth experience. This can also lead to PTSD-like symptoms, and they can kind of get pushed under the rug. And then with breastfeeding or with birth experiences, then this kind of comes back when another baby comes along. So it's something to really be aware of and recognize right off the bat, because there are things that we can do to help minimize the symptoms and the effect that it may have on subsequent experiences. So to start, what is PTSD? And this is something that traditionally has been thought of in the context of soldiers after being in combat during a war, or people after very, very, very obviously traumatic experiences, like their life being threatened by somebody else or something like that. We think about it in the context of these big events, but sometimes it can be with events that are much smaller in scale, but still very much affect the person experiencing it in a similar fashion. We're going to talk about it in the context of breastfeeding and birth trauma here. And I think the first thing is to accept and recognize that you are going through a difficult experience when it's happening, so that you can start to process it afterwards as quickly as possible and with the right resources to be able to move through it and come out in a place where you are ready to move forward. Let's talk about breastfeeding in particular. I've had patients who had experiences where they were having to nurse and pump and then give a bottle to their baby for weeks and weeks and weeks, trying to build up production. This is called triple feeding, and it can be helpful in the short term when, for whatever reason, we're needing to boost production. It takes a lot of time. It is hard emotionally and physically on a mother who's doing this. And afterwards, whether it was successful or not, it can leave you feeling like that was traumatic. And you did all of this hard work and perhaps lost all of this time that you could have been enjoying your postpartum journey, but instead we're hooked up with a machine and worried and not having time to take care of you or get the snuggles that you deserve with your baby. And it can be very, very traumatic. And so let's take this situation a little bit further. So let's say this happens to you. Your initial breastfeeding experience with that baby ends at whatever point it ends. Perhaps you are successful and nurse for whatever your initial goals were, but then your baby weans and you are now expecting another baby. And all of those feelings start to flood back. Am I going to have trouble with production again? Is my baby not going to latch? Am I going to need to do the same thing to reach the same results? And even though you may want to have those same results, remembering how difficult that was can bring back a whole flood of feelings. And so things that a lot of the time people feel with PTSD, there's a lot of different symptoms that may come up. One can be depression, feeling like a failure, feeling a lot of guilt wrapped up in that, feeling anxiety. So in this situation, that anxiety may come up when the next baby is coming, thinking about what happened last time and being anxious that it's going to happen again. There can be some detachment and avoidance of situations. So, saying, I don't care about breastfeeding anymore because it was such a difficult experience, when really you know that you do, but you're trying to kind of cover that up to spare yourself having to go through so much pain again. So acknowledging that and working through it is better than just detachment and avoiding the situation, because then that may just pile some more trauma on top of what you've already got. Also, having flashbacks to the last experience and potentially detachment even from the baby because you are caught up still in the emotions that you experienced the last time. And that can cause us to just shut ourselves off and not really bond emotionally with either the baby who is still growing in our belly or the baby once they are out, if we feel that our wall that we've put up to protect ourselves from these feelings is threatened. So recognizing that you have that trauma in the beginning can help you to seek resources to process that. In particular, a therapist, and particularly a therapist who is trained in perinatal mental health, because they just have more experience with these sorts of situations, as well as with some of the intricacies and nuances that may need to be addressed in the context of somebody who is pregnant or postpartum or who is breastfeeding. And they may know additional resources that could be useful for somebody in this situation. So finding somebody who can work with whenever it is that you're ready after having that experience or while having the experience, that would be ideal as you're experiencing this trauma, to not wait till it's over necessarily, but to have that sort of emotional support right off the bat, helping you get through it, no matter what the physical outcome of the situation is. And that helps you to start to develop a relationship with that person that can then continue on after the actual trauma ends and can then be there for you when this next pregnancy or breastfeeding experience is coming up and things may come to the surface again and need to be addressed in a somewhat more intense way. So therapy is a great way of making sure that you've got some professional emotional support, processing what did happen and helping to process what is going to be happening with a subsequent baby. Another thing is making sure that you have good support for the upcoming experience itself. So not just a therapist to help you process, but what are the things that can make this next experience maybe go a little bit more smoothly for you? Perhaps if it was birth trauma, uh, the birth experience itself was traumatic in some way for you because it wasn't what you pictured, or there were medical interventions that you didn't expect, or you didn't feel heard by the medical personnel, whatever it may be that caused it. That's the kind of birth trauma that I'm addressing here. I'm talking about things that sometimes people don't realize are truly trauma and can lead to something akin to PTSD. One thing to think about is trying to make sure that you have the support system in place around you in terms of friends and family. This is something that I think during COVID, people went through a different kind of birth trauma than we had experienced in the past, with having to wear masks, which was uncomfortable during a birth process, not being able to have all of the people that you had hoped to have with you in the place where you gave birth because of COVID restrictions, potentially having a baby separated from you because you were COVID positive and they wanted to protect the baby. All sorts of things caused perhaps a greater amount of trauma to be experienced by people during COVID. So making sure that this second time around, when there aren't the same sorts of restrictions, you make sure that you have what you want to have lined up for you in terms of friends and family. Doulas can be so amazingly helpful. Doulas are non-medical support people who are there just to support you through various different experiences. There are pregnancy doulas, there are postpartum doulas to help you, not necessarily from a clinical, emotional, or physical standpoint, but from a support standpoint. They know what people are going through in these situations and what might be able to help them. They can sometimes just be there to lend an extra hand, babysit a kid while you're doing something else, make a meal, clean the house, be the night nurse for your baby over the first weeks that are so difficult and exhausting. There's so many different ways that doulas can be helpful, but that's something to consider. And even though I'm not in the insurance system and I'm frustrated by the insurance system and their limitations, in Illinois, a lot of insurance companies are now covering doula care in some way or another. So that's something to look for, that you may even be able to get this care at least partially covered depending on your insurance. And I don't know all the ins and outs of that, but it's something to look into. So considering having a doula, if we are talking about a pregnancy and birth experience, talking to your OB or your midwife, or finding a different one this time, and then talking to them about what happened before, so they know, so that they are there with you and they understand what you went through last time. And it's not that it can always be promised that these things aren't going to happen. Sometimes medically traumatic things have to happen in order to save somebody's life. But if they know what the experience has been in the past, then they may be able to better address how this next experience is going to go forward. So that is one thing. If this is regarding breastfeeding, then having your breastfeeding support ready. So having a prenatal consult with either a lactation consultant or a breastfeeding medicine specialist, depending on what the issues are, so that you not only can process a little bit about what happened before, but also come up with a good plan in place to deal with some of the issues that happened before, so that hopefully they won't be repeated. And then to have your breastfeeding support for after the baby comes. So to be familiar with the resources that are available in the hospital where you're delivering, or have the support there in your home if you're delivering in your home, to have a lactation consultant lined up. If you know that you've got more complicated issues that may require the help of a physician, then finding a breastfeeding medicine specialist ahead of time can be very useful, so that you've got somebody kind of lined up. There are more and more pediatricians like me who are providing in-home care, both for the pediatric services in those first months, as well as more long-term in-home care for your family. And there are people who have things like fourth trimester care or packages, as I do as well, which is when a physician can do usually in-home or a combination of in-home and virtual care for you and your baby postpartum. so that you don't have to be running out, battering the elements. Like today, it's one degree out or something like that. And to have to go out in that with your newborn is very stressful and difficult. And you are recovering from something as well. But those professionals also can help to monitor you, the parent, the mother, the family, as you're transitioning through this fourth trimester, to make sure that you have your ducks in a row and that everybody has the support that they need, and monitor your mental health, your physical health, and then communicating with your physicians as we transition you back to them to handle further care, or in the moment to handle more complicated care that we may not be able to handle ourselves. But to have somebody who's coming into your home and asking you the right questions and checking up on you. This is just something that we don't have in the United States as a default, and many countries do. And it really does change outcomes. And it is something that we need to change in this country to provide more automatically for moms and families and babies. So that's one thing. One thing that you may have heard me mention in other little blurbs, something that I think that is helpful when you're going to have a baby to be ready for afterwards. First of all, it's up to you whether you want visitors. Sometimes it's nice to have visitors because they're helpful. Sometimes they just get in the way, or they want to just hold your baby, but you know that actually your baby's due to eat, or you feel like you need to entertain your guests when really all you want to do is rest. There can be a whole lot of reasons why having guests is not always optimal. You can say no, first of all. But also, when they come over, one nice thing to do is have kind of a running list, have it right in your baby feeding area that you have set up. And every time you think of something that needs to be done in your home, whether it's mopping the kitchen floor, getting a load of laundry done, going grocery shopping, making a meal, whatever it may be, keep a running list of your chores. And anytime a guest comes over, you can say, okay, take a peek at the list, pick one thing. That's what you can do for us. You can even warn them before they come over. Don't buy me an expensive gift. Just come and do something for me. So these are just some ideas to just make this time a little bit easier. It's going to be hard no matter what. It's emotional, it's exhausting. You have a whole new role in your world. You are now a parent, or a parent of multiple kids when you were only a parent of one before. You have a new relationship with your partner, with your whole family. It's a huge change, not to mention recovering physically from a major event for your body. And now potentially, if you're breastfeeding, trying to figure that out, which has all sorts of complications in and of itself, and added stresses and worries and pain sometimes, and all sorts of other things. So being prepared, I think, is a big thing. And people don't necessarily think about that on their first rodeo. I, even having been a med student and a resident and a full-time pediatrician, seeing these babies and families postpartum, I had no concept of how difficult it really was going to be. And I don't think anybody can realize how it's going to feel until you go through it yourself with both birth and breastfeeding. So just knowing that it's not necessarily going to be bad, but it's going to be challenging. And there's nothing wrong with being prepared and having all of your different kinds of support there for you and ready to go when you need them. I feel like I veered off into some other things, but these are all things that can help to either prevent, hopefully, that PTSD from coming to the surface if there were bad experiences in the past, and to address them quickly and professionally and with the correct resources if they do come up again. Getting back specifically to having a perinatal health specialist, perinatal therapist involved, I think, can be very helpful. Not only do they know the nuances and right questions to ask and things to address as you're going through the journey, they also may know the right people to hook you up with if you need additional help. So let's say you do need a pelvic floor therapist, or you do need a breastfeeding specialist, or you need a psychiatrist to help with prescribing medications. They will know the people who are breastfeeding friendly and knowledgeable, or perinatal physical health knowledgeable, so that they choose the right medications and help you get the correct additional resources that you need. So there's a lot to be found out there, and just Googling perinatal mental health professional can be very, very helpful. If you ever have trouble finding resources that you need, you can always contact me. My contact information is on my website and on my YouTube channel. So never hesitate to contact me, even if you're not in my area, to help you to find the resources that you may need. So just to wrap up, this is about how PTSD or PTSD-like feelings and emotions can occur after difficult breastfeeding experiences and difficult birth experiences. And everybody's going to respond differently. Some people may be the type to power through and, I'm just going to make it work this time. And if you're lucky, it's going to go differently the second time and all is good. Some people may feel like, what, this is too much for me. Let's say with the breastfeeding, it's just too much and it's bringing up too much. I'm not enjoying having this baby here with me. I'm going to give formula in a bottle. That's okay if that is your decision and if that is what you need physically, mentally, emotionally. That is always okay. What's important to me is that you have the resources and knowledge to empower yourself to do whatever is right for you. So I, as a breastfeeding medicine specialist, can give you all of the millions of things that we can maybe try to make this, that, or the other thing work differently and get closer to what you envision and want to have happen. But that doesn't mean that all of those things are going to be right for you, or that any of them are going to be right for me. It's just important for me that you are making an educated decision and that you have all of the information that you need to make that decision. Hope that this has been helpful. I hope that you can find those resources. They are out there. The nice thing now is that a lot of things that didn't used to be available for people who are not in a high resource area now can be found virtually. So a lot of these things can be virtual. And if you've had an experience that has been troublesome, you may not realize it until you're about to go through that, or until you are going through that subsequent experience and all of these feelings start coming back to you. So you may not be able to prepare if you don't realize that that's going to happen. But as soon as you start to feel that and realize this is maybe more than just what's normal and you are having trouble and you need some help, just start reaching out to whoever you feel comfortable with, and we will help you find the people and resources that you need. And it's okay. It's a real thing. Many people go through this. These are not easy experiences, even though they're wonderful and can be magical and they are miraculous. They are hard. It is hard. It is a challenge. Having a baby, breastfeeding, being a new parent. These are not easy things, and there really is no handbook, unfortunately. And so we have to figure it out a little bit as we go and just make sure that we've got those people behind us to lift us up and support us as we go through it. Hopefully this has been helpful, and I hope you've enjoyed this episode of Keeping in Touch, and stay tuned for next week's episode. Have a wonderful week.